Hey everybody, I wanted to do a quick video on radiation, how it's going for me, and maybe some things to expect. I'm almost at my midpoint. So I've been in radiation for almost 2.5 weeks now. So I wanted to do a video to tell you what to expect. Well, first off, radiation is just, those are my cats. They're going wild. Radiation is just another type of treatment for cancer. Some cancers you can just do radiation with, some you want to do both with, and then some you can just do chemo. I opted to just do chemotherapy and did not want to do the radiation if I didn't have to, which my doctor was completely fine with, my radiologist and my oncologist, which is my cancer doctor and my radiation doctor. Unfortunately, the cancer came back almost immediately after chemo was over, so I kind of didn't have a choice. I had to go through radiation. Now, radiation... They are wild. They have a doggy door. I can kind of show you. See, they have a doggy door. I hope that got it, but they just like fly in and out of that thing all of the time. But there we go. So, I didn't do radiation, then I obviously had to because the cancer came back. So radiation is painless. While you're going through it, you can't feel anything. You can't see anything. It's just happening to you, and nothing, you can't feel it. Radiation is very, very quick. By the time I pull up to the doctor's office, I'm sorry, my phone, I need to shut that off because it's going to drive me nuts. By the time I pull up to the doctor's office and by the time I get back to my car, it's 15 minutes. Like, getting your actual radiation done is like probably maybe 5 minutes tops. Seriously, it does not take very long at all. It takes you longer to get laid down on the table, to get your mask on, to get them lining you up. That takes longest. The actual radiation part is very, very short. So you really are in and out in 15 minutes. Swear to God. Now, I also go to a place where you park right outside the door. So it's not like I'm parking in a big parking garage and got to walk across this huge lot to the medical building. It's nothing like that where I live. So, it might be a little bit longer, I guess, just your transport time getting to where you want to be. But for me, it's 15 minutes. So radiation is microscopic cleanup of whatever cancer cells may be left in your body. Chemotherapy doesn't always necessarily kill everything. And also, PET scans and CT scans, they can't pick up anything that is less than about 1 centimeter big or about 700 cells. They can't see that. So that's usually why you have a PET scan or a CT scan after a couple cycles of chemo. I know I did. And even though my PET scan came up clean, you still have to finish with like 2 more chemos. That's because the doctors know that sometimes the scans can't see everything. So you have to take more chemo. And that's why you also go through radiation, because there still could be a chance there's something left in there. So that's why they call it microscopic cleanup, is because they're just going in there as a secondary just to make sure that they're killing everything. Radiation does have a lot of long-term side effects that could be, that could be fatal. You could get secondary cancers from it. One of the biggest ones when you're doing neck and chest is hypothyroid. It pretty much killing your thyroid. I don't have a thyroid, so I was okay there. If you get anything to your chest and it goes through breast tissue, you have a chance of getting breast cancer from that. If it goes through your lungs, then you can get lung fibrosis, which is lung scarring, and that actually spreads. So I think my left lung is kind of getting skimmed. So my left lung will start to scar, and then eventually my left lung will be completely scarred and will not work anymore. And I'll just have my right lung. But the doctor says that you can't even tell when that happens because you have so much reserve in your body. Your right lung will just kind of open up areas that it wasn't using before, so you won't even notice. And hopefully that's like super long time down the road. In the chest, obviously, so your lungs, your heart, you can have some heart problems if the radiation is on or close to your heart. So there's a lot of long-term side effects. Radiation, just because it's painless and it's quick, does not at all mean that it's good for you. So that's kind of what radiation is, and how they do it is different for a lot of people. I ask a lot of questions, but sometimes I have to think about it for a lot before I can come up with questions too. So it's kind of an ongoing thing with my doctor and I. We meet every single week to talk about other things and check up on how I'm doing and stuff. One of the first things was I'm a big person. So I asked, like, how does this affect being big? What different is it going to be for me? Is it worse off for me? Is it better? And the physician's assistant, his name is Mike, he was like, it's actually kind of good when people are a little overweight. And the reason he explains it is because you have fat cells in between your organs. So if you're bigger, usually the fat cells are bigger. So they kind of spread your organs apart. So it's easier for the radiation to hit exactly where it needs to hit and not have to hit something else. So instead of like your liver and your stomach being over on each other, if you're fat or fatter, then your fat cells can kind of space them apart so the radiation can hit where it needs to hit. So I thought that was interesting. And he also said, like, prostate guys that have prostate cancer are going in there for radiation, they're asked to come in with like a really full bladder because it just physically moves stuff around down there so the radiation can hit it better. Sometimes, depending on, of course, where your radiation is, they'll have you lay on your stomach. And if you're a little bit bigger, sometimes your fat will kind of move forward with gravity if you're on your stomach and kind of pull your insides in different ways so you can radiate it better. So I thought that was really interesting, and it completely makes sense. So I love it when medical stuff makes sense to you. You're just like, duh, you know. So I thought that was interesting. We have a couple different machines where I go. So the machine that you get your radiation from may be completely different than someone else's. The two machines at the center I go to, they call it, one's fancy and one's ultra fancy. And the physician's assistant, he explained it as they both use the same paint, but they use different paint brushes. So, good Lord, my cats are nuts. They are absolutely nuts. So the one that I'm in, when I get laid down and I get my mask on, and I'll kind of talk to you about the mask, the machine will radiate from me from the top, and then it will actually spin around me and radiate me from the bottom. So the machine like completely moves around. And then there's another machine that's kind of like a donut, and it does not move. It's completely stationary, but I don't use that machine. So I think it depends probably where you're getting your radiation and maybe what kind of cancer you had. I don't know. But that's the machine that I'm in. Now let me talk to you about the mask, because this was something that I did not know was going to happen to me. And this might just be for people that have upper body radiation. Excuse me, I burped. I don't know, but okay, so you go in there for the first time, and what they do is they're going to give you a CT scan. I had Hodgkins lymphoma, if this is for new people. So they're going to give you a CT scan because they want to know, first off, they have to have all the scans from when you were initially diagnosed. Before you got any treatment, they have to know exactly where the disease was. And now they're going to do a scan now to see where the disease is now. And the doctors will treat every single area that the disease was ever in. Even if it's not there anymore, they're still going to treat it. My cancer came back in my neck, but it has not yet gotten to my chest. But they're going to still treat my chest because it was there before. So there still could be something there, hence the microscopic cleanup. So what they do is they get you on the table like you're just taking a regular CT scan. They'll put the dye in you. You'll feel the warm all over. Kind of feels like you're peeing your pants. And they're going to put you in the CT scan machine. This is the thing I wasn't told about. I wasn't told about this mask thing. And this is something, I don't know if they do it for everyone. If you know, please comment and tell me. But I know that they do it for like chest and up people that are getting radiation. But you have to wear this mask. And what it is, it's like a plastic mesh. It's fitted to your face, and whenever you're laying on your table during radiation, they will put this mask on you, and they will kind of clip it onto the desk. So you're like bolted onto the desk table. You're like bolted onto the table. So when they were going to put it on, they said, okay, Casey, we're going to put this mask. It's going to feel kind of wet and moist. It's going to feel weird. So I was like, oh, spa day. And they were like, not really. I was like, okay, whatever. So they take this mask, and it is warm and it is wet, and they stand on top of you and they just like push it down over your face. So your face is like, you know, smashed in, all weird looking probably. And I'm like, okay. And it has like handles on it that they like strap to the bottom of the table. So your face is strapped to the table, and you're like, okay. And then they take a cold towel and they put it over you. So what they're trying to do is they're trying to form this mask to your face. And when they put the cold towel on, it's hardening up kind of that mesh. That's the warm, wet mesh. It's kind of hardening it up so it can form to your face. So that's weird. I didn't know how long this was going to be on me. And they asked me before if I was claustrophobic. And I said no, because I don't think I am. I've been through all the PET scans. I've done all of that. And I'm usually okay. There was one time that I was kind of like, ugh, I don't want to be here anymore. But, you know, it wasn't like bad. So I don't think that I am claustrophobic. So I'm laying there, and it is so tight on your face. And, you cannot move your face. And another thing is that they have to have your neck in a certain position. So when you're laying on this table, they will usually have a plastic insert behind your neck that will like completely crank your neck back. So you have this huge thing that you're laying your neck on, and your neck is just laying over this thing. So your neck is cranked in this crazy weird position, and then you have this mask pulling your face back. So it's extremely uncomfortable, especially if you're not very flexible like me. It's really uncomfortable. My neck was cranked back so far that it wasn't even touching the table. And then I had that thing pushing me down. So my poor neck. Now, I can deal with this for a couple minutes. I have no problem. I was in that mask for, I'm going to say, at least 15 to 20 minutes. Honestly, it felt like I was in there for a day. Near the end, I was starting to get anxious. And I asked, the doctor, I was like, how much longer am I going to be in this thing? And he said, it's only going to be like 5 more minutes. And I was like, I don't think I can last 5 minutes. I have never felt this way in my life. I felt like all I wanted to do was rip this thing off, rip the machine, and just scream run out of there, even though I didn't even have a top on. Like I was about ready to turn to the Incredible Hulk, and I was going to rip the hell out of their $2.5 million machine. I didn't care. Never have I felt that way in my life. Never have I felt that way. And the whole time they're like lining you up. They're putting marks on you because they're trying to line the machine up directly to your mid-center point here and all sorts of stuff here. So they're working on you the entire time that this mask thing is on you, but it was absolutely horrible. And he said 5 more minutes. I can't let you move. We got you all lined up, just 5 more minutes. So that's why I said, I don't know if I can wait 5 minutes, but you better hurry up. Oh my God, it was so bad. And so they all like got out of the room, did the CT scan, in and out, like the fastest CT scan I've ever been in. And as soon as they came out, they took the mask off. By this time it had formed to my face. Oh, it was so, finally, by the time I got out of that thing, it was so much better. I'm the kind of person that I need to know what's coming, or else I might possibly flip out. I usually won't. I'm pretty calm, but that was the worst experience I have ever been through in my entire life. And I told him afterwards, they were like, you okay? And I was like, yeah, but you should have told me what exactly was going to happen. By you just saying, I'm going to put a warm, wet mask on you, that's not anything of what that was actually like. It was hell on earth. Absolutely horrible. So get yourself ready for it. Hell, get a few drinks before you go. Maybe not a few drinks, but definitely take something that might calm your nerves down. Valerian root is a natural alternative. You can make a tea out of it. It's just very soothing, and it just calms you down. That's definitely and this is coming from someone that I still don't think I'm claustrophobic. So this is coming from someone that is not claustrophobic. So if you are, and especially tell them before, because they may be able to give you some kind of a sedative to where you're not just gonna want to turn into the Incredible Hulk. So that's what happened there. And now the day that I came back the next time, I had it on for maybe like 5 minutes. It was not near as bad. They were doing kind of the finishing touches on getting me all lined up and stuff before they did the radiation. And now when I go, I have the mask on for, I'm going to say tops 5 minutes. Absolute tops. And I never have any of those feelings anymore. Number one, I'm used to the mask, so I know that it's coming, and I'm okay with it, Plus, I'm not in there very long. But before, I was in it for a really long time. My neck was cranked so hard. It was so uncomfortable. So I was kind of in pain, and I was pretty much bolted to this table. I couldn't move. So a couple things that were not working in my favor at that time. But now it's totally okay. So it does get better. Plus, you just don't have it on very long anymore. Like I said, by the time you step out of your car to the time you get back in your car, 15 minutes. So you don't have it on hardly at all. but that is something that you do need to be ready for. Don't freak out about it because number one, it's going to happen anyway. You're going to have to go through it anyway. And number two, if you really are worried and you think you may not do well, just tell them, be like, hey, I'm claustrophobic. This may be difficult for me. And for the most part, they can usually find something to do to kind of help you out and help you get through it. But I just did, once I started freaking out, it was a really scary feeling. I just took like really deep breaths and I counted like really slow. And it's mind over matter. That's all I'm going to say. It's mind over matter. And if you can just slowly breathe, focus on your counting and, you know, kind of believe it's going to be over soon. We're cool. And just stay focused on that and focused on your breathing and focused on your numbers. You can get through it. It's all about positive self-talk. So that was that part. Moving on, any of the side effects that I have, the only thing I have right now is in the very, very top back of my throat. It's dry, kind of painful when I swallow. If I take a really big bite of something, it's kind of hard to swallow it and get it down. I think part of it is probably allergies because my allergies are kind of going nuts anyways, and I always kind of feel it in the back of my throat. So I'm sure that that's probably part of it. But when you are going through radiation in your neck, your esophagus can get affected, and it can be just really sore, you know, just sore when you're eating or sore when you're drinking. Another thing is the radiation kills all of the good yeast that's in your esophagus, so the bad yeast can multiply, and if it does that, you're going to get a yeast infection in your esophagus. So, sorry, burps again. I just took my fish pill, and like, it makes me burp, and it tastes fishy. But I meet with the doctor every week, and I told her that, you know, I was kind of getting a sore throat, and so she has me on diflucan, which is a pharmaceutical grade, you know, yeast killer. Pretty much is all it is. You take it for yeast infections. So that's what I'm on now. My throat still hurts just as much, so that's why I'm kind of thinking it might just be allergies, but the radiation is going to make it sore anyway. But I don't think I have a yeast problem in there, but it definitely is something that can happen. I was never prone to yeast infections, but whenever chemotherapy came, I started to get them. So I feel like I'm probably prone to them now, but I do take a candida pill normally. But if you do have a lot of yeast issues, I recommend, my cats are funny, I do recommend laying off sugars, flours, dairy, anything like that can really help you with yeast problems too. Other than that, I haven't hit where I've been fatigued yet. I've had pretty much no physical side effect except for my throat being a little bit sore. I still have hair up on my chest, but not tons. My doctor said that I'm going to lose a little bit of hair on the back because when the machine shoots me from underneath, it's going to kind of skim my hairline a little bit. So she said I will probably lose a little bit of hair on the back of my head, but I haven't lost anything yet. So the third week is usually when they say you start to kind of feel some of the side effects. And like I said, I haven't really felt anything yet. So I still sleep good. I'm not fatigued. Besides the throat, that's seriously all that's going on. But that's something that I'll probably have to deal with, I'm assuming, for the whole rest of the time. But this is kind of my midpoint. So whenever I'm done with the radiation, I'll probably come back and do another video and talk to you like overall what I think about it. But I have a great team, really, really good doctor, and I'm comfortable with the situation that I'm in now. So I go in every day, Monday through Friday. Whoa. If you have to go out of town or miss a day or something, for the most part, your doctor's okay with that. But whatever day you miss, you have to kind of add it on to the end of your treatment. Kind of like if you're in prison, like if you do something bad, then they extend your term. It's kind of like that with radiation. If your doctor says it's okay, sometimes the doctor may say, no, you can't afford to miss one, you have to stay. So you never know. But that's what I was told, that if you have to go or something, talk to your doctor and she can kind of extend it. But that's between your doctor, of course. So that's pretty much all the information I have now. And this is how everything was explained to me. So it's my opinion on how I understood it. So from it coming out of the doctor's mouth to coming into my head is what I'm telling you right now. So if it could be different, but that's just how I've interpreted everything. So if you have any other information to share, please comment, put it down, so everyone else viewing can kind of read and see some additional information. That's what this channel is about. So hope you guys are well, and I'll see you in the next video. Bye.